Hello and welcome to All About Billings. We are a show dedicated to discovering the people who make Billings a great place to work and live. We will interview local business people, community leaders, artists, and entertainers, and we will learn from them all about their successes, their trials, and their connection to Billings. I'm your host, Nancy Brooke, broker and owner at Billings Best Real Estate, and today it is my pleasure to have as my guest Nateal Trowbridge, who is a diabetic advocate and also works for the company as a district sales manager called WellStart. So welcome to the show.
Thank you. Hello.
Hi. Well, it's wonderful to have you here today, and I am really excited to have a great conversation. We had a chance to chat before the show.
I'm looking forward to it too. Thank you.
So let's start at the beginning. You have had a career that has surrounded diabetic care.
Yes.
So how did you get started in that?
I actually started here at the Lincoln Center, going to a medical assistant program. Started at St. Vincent's, working in pediatric specialty care, where I worked for an endocrinologist, and endocrinology is the specialty of hormones and diabetes. Began my career there learning about, type 1 diabetes, metabolic diseases, and other growth hormone type related diseases. After I had my second child, I moved into adult care at Billings Clinic Endocrinology, worked with a wonderful provider there who taught me loads about diabetes, primarily type 1 and type 2 diabetes. And then actually my father was diagnosed with type 1 diabetes in a really unique way, which just solidified my passion for diabetes.
Well, and a lot of times you hear type 1, they used to call it juvenile diabetes, but you can get type 1 diabetes even if you're older.
You can get type 1 diabetes if you're older. Type 1 diabetes is an autoimmune disorder, so your pancreas is attacked by its own body and is no longer producing insulin. In type 2 diabetes, your pancreas is just reducing the amount of insulin it's putting out. I would say your pancreas has some wear and tear, and it's just not working at its prime.
So kind of like a car.
Yes.
The parts aren't quite working the same as they used to.
Exactly, yes.
And who doesn't know that feeling? We were talking about, as you get older, things don't work the same way.
No, from day one, we're running out.
I just remember, when I was young, and my metabolism was so great.
Right, yeah, it was a lot different when we were kids.
And if I was concerned my pants were a little tight, I just would stop eating cookies.
Yeah.
And now it's like, well, no bread, no nuts, nothing to drink except water.
Absolutely,
yes.
Yeah. We could spiral on food quality, and
that too.
Access to has changed. We have access to so many fast foods. We have access to, cheap foods aren't good foods. So access is a huge issue for many of us, myself included.
Well, and ironically, I just was listening to a news conference, I don't know if you caught that, about the food pyramid. And so they're changing the food pyramid. I don't know exactly what they're doing, but the big conversation was about the processed foods and how much percentage all of us are eating these processed foods, which started off as a convenience, for families.
Sure.
And now it's just part of life.
It's definitely a huge thing for, big companies. It's cheaper to make things with cheaper ingredients, and sometimes cheaper ingredients. Bread goes from having 5 ingredients to 50 ingredients. And what's the effect on the body? We're kind of in a science experiment right now. We just won't really know, which, thank you. That's why I'm not an expert on diabetes or nutrition, just definitely have an opinion and a story that has happened to me.
Well, and also you just are an advocate,
yes.
which I love that word.
Yeah.
You have dug in, you've learned what you can, you've worked around diabetes for, it sounds like, your entire career.
Mostly, yes.
And now you have continued to be able to share.
Yes, and just continue to grow and seek out the next best thing. So when I interviewed with the company WellStart, we're a durable medical equipment company. So your insurance partners with either a local pharmacy to get your supplies, or you can get it from a mail order type pharmacy. That's more so what you would think of us as, is like a mail order pharmacy. And how I really ended up in that position was there was one of the big bosses, his name's Bob, and he just was so he was just on fire talking about how we can make a difference. If WellStart does what they do best, which is make sure we process insurance fast, accept prescriptions right away, get in touch with the patients, promote independence, have heart-to-heart conversations, and put things in layman's terms when you need to. It can be intimidating. You just saw a doctor, you just got diagnosed, now you have to get on this supplies. Now you're not sure if your insurance covers it. What are your co-pays? There's so many questions. But to have some people at WellStart who understand what you're going through and know diabetes and care about it, that can really make a difference. And to hear Bob's passion about how a durable medical equipment company can change lives is what really sold me on moving from working in healthcare to working for a company where my position is technically in sales.
So what does durable equipment mean?
So durable equipment is definitely something that's classified within your insurance because it all comes down to reimbursement. So durable equipment could be things from your wheelchair to your CPAP machine to breast pumps to, in this case, diabetic supplies, which could be an insulin pump and all of the intricate pieces that go with your insulin pump, or a continuous glucose monitor, which essentially is for testing your blood sugar, but it goes onto your arm, stays there, and then tests your blood sugar over, a longer period of time.
Right.
Constant.
Well, and before the show, we were talking about how many people in the U.S. have diabetes, and it's like over 11%. It was like 38 some million people have diabetes in this country.
Everybody is impacted by diabetes.
And then pre-diabetes is like more than a third of the population has pre-diabetes.
And we were talking about it, my company just had a get together and had an educational session where we talked with an expert who shared with us that there are patients who are pre-diabetic and can go up to 8 years being pre-diabetic and not even knowing that their blood sugars are having problems. The way he described it was, your body is incredible and it's going to constantly adjust to take care of itself. You get a scratch, it heals itself. You have some back pain, your blood supply heals that too. What he described this as with blood sugars is the frog in the pot boiling. If you throw a frog in a boiling water, it immediately knows that it's, it jumps right out. But if you start the water low and you start raising the heat slowly and slowly and slowly, the frog ultimately boils to death because it slowly over time adjusts to that temperature and doesn't recognize that it's dying in the boiling water, which is horribly morbid. Sorry.
I've heard that
But
analogy.
It was a wonderful analogy for, any of these metabolic diseases or diabetes. You don't know that your blood sugar is running out of normal because your body's constantly adjusting.
Right. Well, and folks, neither Teal nor I are medical professionals, so we're just having a conversation. And, hopefully this might prompt you to think about maybe tests you should have, if you should, basically check how your glucose is. And so we're going to have some conversations about that. So all that to be said, we're not medical professionals.
We're not experts. Please don't take our advice.
Yeah, but, let's talk a little bit about some of the things that we were chatting about. So, for example, a lot of people don't know they're diabetic. How do they find out they're diabetic, and why aren't they doing what they need to do?
I mean, I'm guilty of it, and my husband especially. I don't think he would have went to the doctor if we hadn't gotten married. So it's go to your annual appointment and get the annual blood work done. Most of the time, you'll get a hemoglobin A1C level drawn, which is an average blood sugar over about 3 months. And I'll tell you, after wearing a continuous glucose monitor, seeing what my blood sugars are all the time, an A1C is pretty darn accurate. So if you're getting an A1C that's 5.5, it will represent an average blood glucose of blank. You can look up all those statistics, and honestly, on your lab results, it shows you right there your range of blood sugar.
Well, and the other thing is, there's that phase that's pre-diabetic. And so, and again, as I recall, like anything over 6?
I think it is about 6. I think 6.4 even.
Okay.
But I know in the high 5s, you're considered pre-diabetic.
Right.
You and I were sharing with each other, I personally have dealt with a pre-diabetes diagnosis.
Right.
And it is a threshold that is high normal, I would say, a high normal A1C. Sort of a call for attention to your diet, attention to your blood sugar levels. It's time to start thinking about what happens if you get diagnosed with diabetes.
Well, and, again, not to be morbid, but diabetes is a contributing cause to a lot of problems. I mean, you can have kidney failure,
cardiovascular disease.
Yes,
you're right.
Amputation. Yep. There's so many things that can happen from diabetes. So if you can prevent it from
Exactly.
becoming full force
Yep.
diabetes, that is the best option.
I was talking out in the front before you got here, and we were just sharing with each other our stories and, you know, our family members who have been impacted by diabetes. And you don't realize how much control you have. There's not a lot of diseases where you get control. If you get diagnosed with cancer, a lot of it's out of your hands, and you have to hope for the best. And the doctors try a therapy, and we hope that things improve, right? With diabetes, you can know what your blood sugars are every single day, all the time, if you wear technology that promotes that. So it's pretty awesome that diabetes is a diagnosis that you can have a little bit of control.
Well, and we were talking earlier about continuous glucose
Mm-hmm.
monitors. So a lot of times, and I thought that it had to be prescribed, which I think it used to be that way, but
Yeah.
you said you can buy them at the pharmacies now.
Yeah, you can buy them over the counter at the pharmacy. You sure can. I think, too, patients forget that they have options. If they want to go to a local pharmacy, great. But the smartest thing to do would be to call your insurance and see who's in network. If you can go through a mail order pharmacy and get a discount, do that. If you can go and use, you know, one of the hospital-based pharmacies versus one of the other commercial options, find what's most affordable for your insurance plan. A lot of the times the doctors know this information too, but again, you have to advocate for yourself.
Well, and you know, one of the things that I found interesting, so my blood sugar, it's not quite pre-diabetic, but it's, I'm going to call it pre-diabetic.
Yeah.
So it's a little higher than maybe I'd like it.
Sure.
The one thing that I found is when I ate certain foods, like my hunger would go crazy. And so it kind of made me clue in like, okay, maybe I just need to eliminate all of the suspect foods, see how it works, and then maybe try introducing things.
Definitely.
And so I'm not saying it's for everybody, but for me, commercial wheat bread is a real problem.
Sure.
Now, I've since bought homemade organic sourdough bread.
Yeah.
I have zero problems with
Isn't
that.
that nice? I would rather eat organic sourdough.
Right, but you know, and I think it's not only how it's made, it's how it's processed.
Agreed.
There's, I can't remember the official name, but the Roundup in some of the wheat that we eat. So that alone could be an awareness you get either from your hunger or doing a continuous glucose monitor.
Definitely. I think there's trending popularity around what's in our food right now in the country.
Right.
I think people are starting to question, why are things legal here that aren't legal in Europe?
Yes.
So how do we make an impact as regular common citizens? We have to keep talking about it. We have to keep questioning and asking for change, for improvements. And we have to do that by being independent, proactive patients. So,
Well, and do your own homework.
yeah, exactly. And do, like you were saying, it's an experiment that you're going through.
But I mean, it doesn't make sense if I just ate a meal that I'm starving an hour later. I
Right.
mean, you know, and you're monitoring, okay, that's maybe about 500 calories. That's plenty.
Sure.
So I shouldn't be like, I've got to eat now.
Yeah.
Like I'm a maniac hunger.
Right. Yeah. We were talking about that food noise a little bit. I would say, kind of to touch on the continuous glucose monitor again and personal changes. The first time I wore a sensor, I went out and I was on the phone with my sister. She's my favorite person to talk to. And we were just having a chat, and I was throwing the ball for my dog in the backyard, just picking it up, throwing the ball. Did this maybe 10, 20 times, and then decided to go inside. So I'm not exercising, walking around the block. I'm not going to the gym. I'm not doing anything big, but it was enough low moderate activity that my blood sugar went from up into the mid 150s down to about 100. And it was just enough activity. And so it really is just interesting to see what impacts you. You know, versus me. Another thing that happened was I thought, oh, I'll never have pasta again. And I love pasta. Well, I ate spaghetti pasta and my blood sugars really didn't change at all. It was very normal versus like a cereal or maybe your processed wheat bread. It's interesting to see how everybody's body is going to go a little bit differently.
It is.
So it's a personal journey for sure.
And we all hear like blanket recommendations. I mean, either, you know, and I'm not talking about for ethical reasons, you can't eat meat, it's bad for you, or you can't eat grains,
or no carbs
no
because
fats.
you have diabetes.
Yes.
No carbs now, which is hard, you know, and especially, you know, there's a stigma around diabetes because it used to be, oh, you're diagnosed diabetes, now you're so sick, you're on insulin. And I can't tell you how many times when I was working in healthcare that I heard, oh, I'm not that sick, I'm not on insulin, I'm not that sick. That's an old stigma. Insulin is a hormone medication that is a solution to high blood sugar. If your blood sugars are too high, you know insulin is going to treat it. it shouldn't be looked like down upon that you have to be on a medication. Honestly, it's a personal journey too. But I think you know what I'm talking about when there's that stigma with diabetes that, you know, oh, well, you can't have dessert now, or you can't have this or that. The fact of the matter is nobody should be having 2 servings of cake. No one should have cake every single night. No one should have pasta every single night. There should be modifications for everybody in everybody's diet. The biggest thing I think that I like to promote about WellStart is that we understand diabetes, meaning we're going to be there for you when you're having a conversation or when you're having a hard time. Or I have a patient who was referred over to us and we don't accept their insurance, but she's having the hardest time ever finding it in a durable medical equipment company that takes her insurance. So we've just been following up with her on the phone, just calling and saying, hey, you haven't been forgotten about. What can we do to help you? And, you know, she says, well, they're not answering my questions. So we coach her and say, well, then be sure to ask, you know, what's in network, what's out of network. Can I get tracking information? These other companies should be able to provide that too. So we're promoting patient independence so that she can advocate for better care for herself. We don't leave people high and dry. So if we get an insurance that's out of network, we're going to make sure to check their in-network benefits, and then we're going to forward that prescription to something that's in network. And we don't leave patients hanging. We tell them, make sure you know what's going on with your insurance so that you can find the best deal for you.
Well, and the care can be so expensive.
It sure can.
I mean, insulin is expensive. You know, we were talking before the show, now we have a new grade of medicine, GLP-1s. I mean, they've
Very
been around
popular.
for a while,
Yes.
but,
Yeah, they
but
have.
now they've become more popular. And so there are things that are making a difference before you get like to a really bad situation with your diabetes.
Yeah, and again, I mean, just to touch, again, not a medical expert by any means, but the frustrating thing just being community members and patients ourselves is that you don't have access to some of these medications. Insurance doesn't want to cover it, and it all depends. You could have 5 people in the room who have the same insurance and they all have different coverage, because their employers pick and choose what's covered when they sign up for the policy. So you could have one person who gets the medication and one person who doesn't, and there's not really a fair solution to that. But I can say if we advocate for ourselves and I guess I'll touch on the fact that for these GLP-1s, especially for weight loss, it's really important that providers are still prescribing it, even if they know it's going to get denied, because that data goes somewhere. Someone's looking at it. Someone knows, right? And insurance wants to make money. Insurance wants to have healthier patients. They want to have, everyone wants a profit. So they're going to look at that data and say, okay, we could get more money from our patients if we allowed GLP-1s maybe. And so that data is going to go somewhere. So even if you know you're going to get denied, I still personally think it's important to have that denial on file, because then at least insurance can look back. I would hope. Maybe I'm optimistic, too optimistic. Well, I would hope they're looking at that data.
Well, and the GLP-1s, I mean, right now people are more talking about it for weight loss.
Definitely.
I mean, which is also a wonderful effect, but it does help with diabetes.
I mean, when you're talking about metabolic disease in general, if you're losing weight, then you're gonna have a lot of benefits. Your organs aren't on as much stress. You're able to move more. You have more energy, and diabetes in general is a nutrition disease. So insulin opens the cells to access to nutrients. So if your insulin isn't there, that's why you need to have an insulin injection so that the cell can absorb nutrients. That's why you'll see glucose levels are higher in your urine, because your cells aren't able to metabolize that nutrients. So the glucose spills over, hence the sweet urine, hence they'll test with a strip to see if you have any spillover.
Well, and probably why the hunger's there. If you're not getting the nutrients, then your body's like, hey, I'm still hungry.
Exactly.
Because it's not able to process the food you've taken.
So I think another really big thing as a patient, I would encourage that people talk to their providers about all symptoms. Don't ever think that one of the symptoms isn't important, because insurance sets very specific rules and hoops for people to jump through in order to get qualified. And it's not fair that they don't set out the rules for everybody to see. Sometimes your provider doesn't even know what hoops they have to jump through in order to get approved. And they're under tremendous stress too, to see enough patients and to fill their day. And then, you know, all of this meticulous work and time consuming work that goes in, 1 patient per day times 20 patients per day, you know, it really adds up. So talk to your providers about all symptoms. If you're feeling hungry, if you're feeling cold and clammy, anxious, hunger symptoms is what I like to call them, because you can, a lot of the times insurance wants to see low blood sugars, problematic low blood sugars, to qualify a patient for diabetes technology.
Sure.
But patients don't think they're running low because they're not technically low. But if they are having symptoms of low because their body is used to running at 300, then they're still symptomatic. You're still experiencing a low blood sugar, even though, or a low blood sugar symptom, even though your blood sugar is high. Because now you are modifying your diet. So we'll say newly diabetic, diagnosed, your blood sugars are running in the 300s, and now you've just been put on this new plan to eat less carbs, to exercise, and you're really sticking to your plan. You're like, I'm going to do this. I'm going to get healthier. Well, now all of a sudden, all of these things like eating less carbs and exercising and sticking to your routine that your doctor recommends is working. And now your body is experiencing lower blood sugar levels, and your body goes, whoa, what the heck's going on? You know, and then you have some of these hypoglycemic symptoms without a true number of a hypoglycemia level. So you can kind of, it's like a play on words almost, you know.
Well, and you know, the other thing that I find interesting is, so you can not be approved for some of these medications, some of these tools, but sometimes you can find alternatives. Like sometimes you can pay out of pocket, and it doesn't have to be, you know, $1,000 a month, let's say.
Definitely, you know? Yeah. I wish in a perfect world there was someone out there who, maybe it's my perfect job somewhere someday, where you could just take diabetics who are going through the challenges of their own insurances, the own hoops that they have to jump through, and there was like a life coach who could say, okay, we're going to call together and we're going to ask the insurance this question, and then we're going to find solutions because this is too expensive for your budget, but we're going to look for this option. You know, you and I were talking about the over-the-counter continuous glucose monitors. That's an option, but you know, $50 to $100 a month looks a lot different for some people. That's a lot of money.
Sure, of course. And you know, it might be something like, I personally would be interested in doing it. I probably don't need to do it long term.
Yeah,
I just would be interested to see
Sure.
what affects my blood sugar.
Yeah.
And that's probably good data.
Yeah, definitely.
To know.
Definitely good for you, good for your doctor, good to see how it's going. Definitely a conversation where you need to talk with your provider about this, which I think is why it's so important to, not the day before your doctor's appointment, the weeks before your doctor's appointment, to write things down and say, what am I really wondering? How am I going to achieve my goals? How can I be a proactive patient? Because one of the hardest things and the hardest conversations I have when I'm still talking to patients is that insurance will say, well, that the last office visit note from your doctor is not approved. They didn't say this, this, and this. So just go back. Well, I don't know if you've noticed, Billings is growing really fast, and I don't know that we're hiring enough specialists. Maybe there's not enough specialists moving to town. That's a lot of pressure to put on your doctors to see you in 2 weeks just so you can get something. So we really have to know, what are the qualifying factors for our specific insurance, so when we go to the doctor, we can get what we need. Do we qualify? You know, help your doctor find that out. Don't just assume that they have the availability to see you in 2 weeks, in 1 week, in a day.
Well, and I like what you're saying, be your own advocate.
Yeah.
Ask your own questions, but also you can listen to what your doctor says in terms of lifestyle changes.
Absolutely.
But do your own research too.
Yeah.
You know, there's so many groups out there, like Facebook groups. There's probably local diabetic groups, I would imagine.
Yeah, lean on each other, definitely. That's one thing I love about Billings and Montana in general, is the diabetic community is super close. There's family retreats, there's support groups for not only patients who are experiencing diabetes, but their family and their loved ones. You know, if you have type 1 diabetes and you're a child, then your mom or your dad or your grandparents, whoever is in the house with you, is going through having to wake up to alarms in the middle of the night because your blood sugar is going low, having to constantly make decisions based on every single meal. And that can be really stressful.
Absolutely.
Being a parent is just stressful in general. I can't imagine dealing with a chronic disease. So,
well, and the other thing that, from my understanding, you can basically you can't reverse diabetes, but you can, I guess, not suffer the symptoms of it. So it won't ever 100% go away. It'll kind of always be there in the background.
So once you're diagnosed diabetic, you're always diabetic.
Right.
And so that's a big deal. And I know a lot of people find themselves in a position where they say, I will gain access to a continuous glucose monitor, maybe a GLP-1 medication, and once I'm diabetic. But what does that look like for each person? You just don't know. And like you said before, a diabetes diagnosis labels you as predisposed to other chronic diseases. You could have cardiovascular disease, you could have kidney disease. We all know the stories. So you don't always want to wait until you're diabetic. But if you are diabetic, know that you can use that diagnosis to help you gain access to tools. If you're pre-diabetic, then how do we have a different kind of conversation with our provider to get access to the tools that we need? And if insurance is going to pay for it, what does that look like? What other options are there? Like you said, I mean, it's just about community joining together and asking the right questions. You know, saying, Nancy, do you know anybody who knows about diabetes? You're welcome to give my phone number to anybody and they can call me and I'll say, I don't know the answer, but I might know someone who does. And then we'll reach out and we'll connect each other to resources.
Well, and I just love the fact of people being self-empowered.
Yes, me too.
I just think that's so helpful.
Me too.
And you know, while you can't cure it, you can, I guess, put it in remission. I guess that would be how we would describe it.
Sure,
right?
you can embrace it. You can deal with it right then and there. And all of us have been on some sort of a wellness journey, and you start to feel better when you're doing what's better for you. So you're putting good in, you're going to get a little bit better out. Right. And the same thing for when you're dealing with insurance calls that are complicated. If you put good intention and good effort in, you're going to have a better outcome too. You're going to feel better about, I know what my insurance coverage is. It's not out of your scope at all. You can handle these conversations. It's a little intimidating, especially because like people like my husband can't even order pizza for himself. If there's an app, he's great. But if he has to make a phone call, we're going to starve.
Yeah.
We're going to starve. So, but you can handle those conversations. And there's people out there who care. You know, like myself, I would get on the phone and talk with anybody's insurance to help them.
And so how do people access your company? So how did they find out?
Yeah,
about
I almost
you?
forgot I'm here for WellStart as well.
That's
Sorry.
Okay, yeah. No, I just want to make sure as we're winding down that we get in a little plug.
Hit on my job too.
Yeah.
Okay, so WellStart, like I said at the beginning, is a durable medical equipment company. Your provider can send us a prescription. We accept prescriptions directly from your EMR, your medical record system, or patients can call us too and just say, I'd like to use your services. And then we'll get some demographic information and we'll reach out to your provider's office. We like to help the clinical staff. We kind of touched on that a little too. There's so many phone calls and authorizations and need to know scenarios that nurses are dealing with and medical assistants are dealing with for their providers, times every patient in one day, times the week, times the month. So WellStart has a wonderful customer service that is willing to go above and beyond, do those authorizations, have those phone call conversations with patients and get them in touch with the best resource for their unique insurance plan.
So WellStart, you're in Billings.
So WellStart, we're in Billings. By that we mean just Teal.
Yeah, Teal's in
just
Billings.
Teal.
Okay. Everybody
else is in Florida, Arizona, San Diego.
So you're a nationwide
company. We are a
company.
nationwide company. We are growing so fast.
Awesome.
So fast. We started in 2019. Everybody who was part of the original team is a diabetes advocate or expert, would you say? They all have been impacted personally and they all have worked within some type of specialty company. So we all bring something unique to the table.
Well, it sure has been fun having this open conversation with you about diabetes and how we can make life better if we're bordering on pre-diabetic or if we're diabetic. Hey, let's take some action, find some resources. Sounds like Teal's an open book here at WellStart. And everybody, thank you so much for joining us today, and we hope to see you next time on All About Billings.